I'm in London, so
Oh,
yeah.
okay. There we go. Okay, we'll just give people a couple minutes. Still not one yet. So is London where your offices are, or are you guys spread around a bit?
Yeah, so we have a location in London. That's the one that I manage and work at.
Mhm.
And then we actually have 2 other locations in the country as well, one on the West Coast and one in Manitoba. So,
Oh, nice. That's
yeah.
great. Good stuff. Yeah, so we're really trying hard to promote Health Depot to our members because it's fairly new for them. We had been doing the same thing with pocket pills for the last couple of years, so now we're trying to shift them over from the pocket pills thinking to the Health Depot side of the balance sheet. So hopefully we'll get some
Yeah, well,
interest
I
in it.
appreciate the opportunity. And I mean, I think interesting to take this sort of focus around chronic pain management and talk about that. And
Mhm.
then sort of, add into that where we can be of particular benefit as the Health Depot and our service offering. So yeah, I'm really excited to have this opportunity for sure.
Yeah, that's great. Just so you know, I have another meeting later, so I won't sign off the webinar. You can do that if you're good with that, just to thank people for coming after the Q&A.
Great.
So yeah.
Will somebody be monitoring questions at all or
How would you like?
moderating?
Typically, we've done it so that the speaker does that.
Sure.
So if you're
Okay.
comfortable with that, it's worked well for us.
Yeah,
Yeah.
absolutely.
Okay. Terrific. Good. I'll just give them maybe one more minute and then introduce you, and away we go. You have the honor of being our first webinar of 2024.
Oh, hey, always nice to be first.
You got to set the stage for the whole rest of the year.
Yeah, no pressure. You could have waited till the end to tell me that,
Yeah,
maybe.
right. Okay, well, I'm going to introduce you now because it's 1 o'clock and I want to respect people's time, and people can join as they're able to and drift into the webinar. But so for those that are with us, thank you for joining us today. I'm really pleased to have Health Depot here. Health Depot is one of GreenShield Canada's partners, and they are a virtual pharmacy that can really save you some time and money. And we thought rather than just having them talk about the services that Health Depot offers, although you might touch on that, Drew, we wanted to give you some good information to take away. And so we thought that pain management would be something that pretty well all of us at some point in our lives can relate to. Seems to be a part of living. So I think Drew's got some good stuff he's going to share with us on that. There'll be an opportunity at the end to answer for him to answer questions that you might have. So please hold on to those. And Drew, thank you very much for taking the time today to speak to our members. We really appreciate that. And I'm going to turn it over to you.
Well, thank you very much. Very excited to be here, and I understand I'm the first of 2024, so that's very exciting. Just give me a moment here to get myself set up. I'll make sure that we've got things working properly here. So I just want to confirm, Karen, can you let me know, are you able to see my first slide okay?
Yep, looks good, Drew.
Okay, great. So thank you very much and welcome everybody. Thanks for joining today. My name is Drew Petty. I am a pharmacist and I'm also the pharmacy manager of the Health Depot Pharmacy at our London site. We are a digital pharmacy based in London, Ontario. And our convenient digital presence and ability to ship directly to your home, work, or cottage, as well as our unique focus on providing a really enhanced clinical level of care, are what differentiates us from other pharmacies. So in the context of that, we're actually going to talk in this webinar about how pain occurs and is felt by the body. We'll discuss some common non-medication and drug therapies for pain and how chronic pain sufferers benefit from an engaged pharmacist in their circle of care. And through that, I hope that you'll learn more about the Health Depot Pharmacy and what we offer in terms of service. So first off, Navigating a life in pain is a very personal journey, and it's shared by a lot more people than you might think. Pain, of course, is a universal experience that goes beyond just demographics. It impacts lives across all ages and genders and backgrounds. It's very pervasive in our communities, and this underscores the imperative for a comprehensive and very collaborative healthcare practice to take care of pain sufferers. Addressing pain comprehensively is not just a medical necessity, but it's an ethical obligation to ensure the well-being and quality of life for individuals in our community. The March 2021 report of the Canadian Pain Task Force indicated that 8 million Canadians live with chronic pain on a daily basis. It is the leading cause of disability worldwide. It's a very unique experience that is influenced by an individual's biology, psychology, spiritual factors, social factors, and emotional factors. And it carries a very disproportionate burden. Children, seniors, racialized populations, patients with mental health, veterans, women, people with disabilities, Indigenous peoples, and those in the LGBTQ2S community have a much higher prevalence of pain than other populations do. Pain is a very individual experience, and when the medical definition of pain was updated in 2020, after 44 years, it included a number of concepts that underlie how each person experiences pain in a unique way. So first off, pain is always a personal experience that is influenced by biological, psychological, and social factors. Pain and how pain is sensed, or nociception, are different phenomena. So in other words, a person's experience of pain can't solely be inferred from the neurons that are involved in the pain. Individuals also learn the concept of pain through their life experience. So they learn how to cope with pain starting from early on in life, and also how their pain is managed influences how they experience that pain as time goes on. A person's experience of pain should always be believed and respected. And while pain can be an advantage from an evolutionary perspective, it can also be what's known as maladaptive or bad. It can have an adverse effect on function as well as a person's social and psychological well-being. Previous definitions excluded those who cannot communicate verbally from being able to express their pain. So the new updated definition also highlights that nonverbal communication should also carry a lot of weight when it comes to talking to people about their pain. So pain is quite complex. We talk about 3 different categories of pain. You can think of pain like a warning system in your body. When something isn't right, it sends signals to your brain through your nervous system to let you know. But this can get a little bit tricky, and there are 3 main types of pain. So in the middle here, you'll see normal pain. The scientific term for that is nociceptive pain. And this is the kind of pain that makes sense. It results from an actual or potential tissue damage and usually serves as some sort of warning signal that something is happening in the body. For example, if you cut your finger and your body says, hey, we have a problem here, it's a direct response to an injury and it helps to protect you. This type of pain is typically described as aching, throbbing, or sharp. And it's often proportional to the extent of tissue damage. So a person experiencing a minor cut is going to experience that pain in a more minor way, but a person with extensive burns across their body, for example, is going to have a much greater extent of pain experience. Other examples include surgical incisions, fractures, or inflammatory conditions like arthritis. On the left, you see nerve pain. So this is also known as neuropathic pain. A lot of people are quite familiar with that term. It's like a miscommunication in the warning signals in your nervous system. So your nerves might be telling your brain that there's a problem when there isn't really one there anymore. And this type of pain typically feels sharp, shooting, burning, tingling, or like electric shock or pins and needle sensations. Common examples of neuropathic pain include diabetic neuropathy, which is when uncontrolled blood sugars cause damage to the nerves, and people often experience this in the feet, a tingling sensation, sciatica or low back pain, and also post-shingles neuralgia. So if anybody's ever had a shingles infection before or experienced that with individuals, you'll know that oftentimes the pain will last a lot longer than the actual rash does. On the right, we have the third type of pain, and we're actually going to focus more in on this. This is what's known as confusing pain or nociplastic pain. It's a term used to describe pain that arises from altered sensation, where the nervous system becomes more sensitive without any clear evidence of ongoing tissue damage. So sometimes this warning system gets a bit confused. So even if there's no clear injury, your body might still think there's a problem, and therefore you feel pain. It's like a false alarm, but your brain takes it very seriously. In this situation, pain perception is heightened, and the intensity of pain often doesn't correlate with the extent of tissue damage or inflammation. We often also see the recruitment of additional pain receptors in this type of pain. So often the sensation of pain will occur quite distant in the body from where the initial injury even occurred. Examples of this type of pain include fibromyalgia, chronic migraine, and certain types of chronic low back pain. Managing pain is like untangling all of these different signals, and it really involves figuring out where the mix-up is happening and finding the right way to fix it. And it's not always a simple fix, and a team of experts that include doctors, therapists, and pharmacists work together, or should work together, to help your body send the right signals and feel better. It's important to note as well that there's different definitions and different correlations of chronic pain and acute pain. So acute pain is usually pain that will last less than 3 months. It's known as protective or adaptive pain. The body is essentially creating a withdrawal response as a way to avoid use of an injured body part to protect it while it heals. And we typically see acute pain gradually resolving as whatever damage has occurred also heals. Chronic pain, on the other hand, tends to last greater than 3 to 6 months. It's not protective, or it is maladaptive, meaning that the pain becomes counterproductive or even debilitating over time. It can occur without a known cause, or at least without a sort of current cause. And it's the type of pain that's divided into the neuropathic, nociceptive, and nociplastic pain. It's important to note that the World Health Organization actually recognizes chronic pain as a separate disease state all of its own. So it's not simply a symptom of something going on. Untreated chronic pain has a really big impact and diminishes an overall person's overall well-being. So chronic pain, with its persistent presence and its multifaceted effects, significantly diminishes a person's overall well-being. It influences their physical abilities, their emotional state, their day-to-day life, and it really highlights the urgent need for comprehensive and personalized medication strategies. And that's one of the strengths that we offer at the Health Depot, is looking at that personalized medication strategy. Untreated chronic pain will diminish physical functioning. So it limits mobility, makes it challenging for individuals to perform regular physical activities like walking, standing, or climbing stairs. It often disrupts sleep patterns as well, and that leads to fatigue, which then impacts the overall physical feeling of pain, making it difficult for individuals to sustain their energy levels throughout the day. It can negatively affect emotional well-being. Chronic pain is associated with the development of mood disorders such as depression and anxiety, and those things obviously can further reduce overall quality of life. Constant pain can contribute to irritability and frustration, and that can impact relationships with family and friends. And so individuals with chronic pain may develop adaptive or maladaptive coping strategies, and that then influences their emotional response to pain as well. So they may find ways of dealing with the pain that actually make them more anxious, for example. It can impact social interactions, causing things like social isolation and relationship strain. Chronic pain sufferers will often withdraw from social activities due to the fear of exacerbating their pain or making their discomfort worse. And the emotional toll of chronic pain can strain relationships with family and friends, especially since they may struggle to understand the persistent nature of the condition. Individuals can also start to experience difficulties maintaining employment due to reduced productivity, absenteeism, or challenges in performing their job duties. Cognitive function can decline. Chronic pain can affect cognitive functions, including concentration and memory, and that makes it challenging to focus on tasks or remember important information. Dealing with chronic pain also, again, leads to significant mental fatigue, and that in turn affects cognitive abilities and decision making. Chronic pain can affect lifestyle and result in lifestyle modifications being necessary. So chronic pain often necessitates modifications to daily activities, which then limits participation in things like hobbies or recreational pursuits. A lot of medication management can be very complex when trying to control pain, and so individuals might need to adhere to complex medication regimens, which in turn can impact their daily routines as well as their activities, especially as we talk about different side effects that can occur. Chronic pain may result in increased healthcare expenses and decreased work productivity, and this leads to financial strain as well. And then last but not least is the emotional toll. Chronic pain diminishes the ability to enjoy life, as individuals may avoid activities they once found pleasurable. It requires ongoing emotional and physical effort, and that can lead to exhaustion, emotional exhaustion over time. And the uncertainty of living with chronic pain may instill fear about the future, contributing to stress and anxiety. So you can see from this that there's a lot of reasons why we need to really treat pain and why we really need to consider the whole individual when we treat pain. So this is an example of what we call a multimodal approach. We call it the 3 M's, and it's sort of a guiding principle as the best way to manage pain. The 3 M's are movement, mind, and medication. And you can think of this as kind of a toolkit that's tailored to each unique patient. So simply put, addressing each of the things in these 3 buckets is more likely to yield improved pain control outcomes for any one individual patient. And typically, the combination results in better control beyond even just the sum of each mode. Chronic pain is very complex with multiple contributing factors, as we've already learned, and addressing it comprehensively requires different and complementary approaches to tailor treatments to individual needs. The benefits of this approach are, 1, it provides holistic care, which addresses the physical, emotional, and social aspects of chronic pain altogether. It allows for individualized treatment plans, tailoring the interventions to the unique needs and circumstances of the patient. And research suggests that a multidisciplinary approach can lead to better pain management outcomes, increased functionality, and improved quality of life. And in my practice, when I'm dealing with patients, it's often really quite a struggle to get them to understand that medications are one way to treat pain, but these other things, the movement and the mind categories, are equally, if not more important, and that they really work all together. Speaking of working all together, this 3M approach does require a multidisciplinary team. So we'll have physicians and specialists providing medical assessments, diagnosing underlying conditions, and prescribing. We'll have physical therapists who focus on improving physical function and mobility through exercises and rehab. We'll have psychologists or psychiatrists who helps to address the psychological impact of chronic pain, helping individuals better cope with stress, anxiety, and depression. We'll have occupational therapists who assist in adapting daily activities to reduce pain and improve overall quality of life. And very much important as well, we'll have pharmacists, and they will contribute to medication management, ensuring safe and effective use of prescription drugs and offering ongoing monitoring. So I just want to briefly zoom in on 2 of these aspects, movement and mind. So under movement, you'll find that there's a number of items there: physio, occupational therapy, acupuncture, massage, cold and heat therapy. Essentially, all of these things are physical techniques that are designed to help reduce the pain. So for physical therapy, we'll have treatment regimens that are tailored exercise programs, and those help to improve strength and flexibility and mobility, and that those can then address specific pain-related issues with motion. They can use stretching, for example, or strengthening routines, and these will enhance physical function, reduce pain, and improve overall well-being. You'll also have occupational therapy, and these assist individuals in adapting their daily activities to minimize pain and maximize their independence. So they'll teach things like energy conservation techniques, joint protection strategies, and maybe recommend assistive devices. And this improves their ability to perform daily tasks and enhances the quality of life. In the mind category, you'll see things like CBT, or cognitive behavioral therapy, breathing exercises, mindfulness, and biofeedback. So these are really all about training the mind to cope with pain and then resolve the mind-pain feedback loop. So for example, cognitive behavioral therapy addresses the psychological aspects of pain by helping individuals change negative thought patterns and behaviors associated with that chronic pain. And we do things, or they do things like cognitive restructuring, which is like reframing your thoughts about pain, relaxation techniques, and behavioral interventions. These help to reduce pain-related stress and distress, and improve coping skills and improve emotional well-being. Mindfulness teaches the mindfulness meditation approach and awareness to reducing stress and pain perception. So we use things like meditation, yoga, meditative breathing. These increase the ability to recognize pain and the symptoms of pain earlier on, increase pain acceptance, improve emotional well-being, and enhance overall mindfulness and coping strategies. And then we have things like biofeedback, for example, where basically what we're doing is we're giving individuals real-time information about their physiology as it relates to pain and enable them to gain control over certain bodily functions. So this could include monitoring and controlling muscle tension, monitoring and controlling heart rate and breathing rate, and other physiological responses. And it leads to increased awareness and control over the physiological response to pain that can lead to pain reduction. One thing that's really important about these two items, or these two categories, is that when incorporating these non-medication therapies, it's really important to work with a healthcare professional or a multidisciplinary team to develop a comprehensive pain management plan, which is then tailored to an individual's needs. Getting into medication, and this is obviously where my biggest role lies and where my biggest interest lies, medication plays a really crucial role in addressing chronic pain. It offers a spectrum of options designed to alleviate discomfort, improve functioning, and enhance overall quality of life. And from analgesics to more specialized medications, understanding the diverse array of treatment possibilities is really fundamental to crafting an effective pain management strategy tailored to the individual. And that's what our pharmacists do. They help to really assess a patient's medication therapy and determine from a medication perspective what could be improved, what's working well, what's not working well, and provide recommendations to the team to adjust therapeutic plans as a result. So there's a really diverse array of treatment actions and options. We have analgesics, which can come in the form of oral analgesics and topical analgesics. We often talk about a pain pyramid, so a gradually intensifying therapy of medications to treat pain. And the analgesics are typically the base of that pyramid, so it's the thing that we should always try first. These are, simply put, they're pain relievers. So oral analgesics work by blocking certain chemical signals that result in the sensation of pain, whereas topical analgesics essentially are counter-irritants. So they're chemicals that exhaust the overlying nerves from a pain area, and that makes it so they don't sense pain as much because they're essentially tired out. A common analgesic is acetaminophen, which is often used for mild to moderate pain. And it's really important that analgesics be used as directed. Very important that patients don't exceed the recommended dosages, because that can lead to severe damage in the body, especially in regards to the liver. So education and proper precautions around the use of these medications is important. Next up, we have the non-steroidal anti-inflammatories, or NSAIDs as they're known. These reduce inflammation, and inflammation is intimately connected to how pain is felt and the physiological process of pain. So if we can reduce inflammation, we can often help to reduce pain. You'll commonly know things like ibuprofen, for example, or naproxen. Other common ones include celecoxib, for example. And a topical one is Voltaren gel. So that's actually a topical anti-inflammatory that penetrates through the skin and relieves pain by impacting the chemical cascade involved with inflammation. These drugs as well need to be handled with appropriate precautions. There are often potential side effects like stomach upset, and it's often advisable to take these medications with food or some kind of protective agent, like another medication that reduces stomach acid while on these medications. Prolonged use can be associated with an increased risk of stomach bleeding, and these medications can also damage kidney function if they're used under the wrong circumstances. So, for example, if a person is very dehydrated from a vomiting illness or diarrhea illness, oftentimes we have to recommend to patients that they hold their anti-inflammatories so they don't damage their kidneys. We use antidepressants in pain, and this is often a little confusing to patients, but also sometimes other caregivers as well. So there are certain antidepressants like amitriptyline, which is known as a tricyclic antidepressant, and also other antidepressants known as SNRIs. An example of this one would be a drug called duloxetine or Cymbalta. These can help manage chronic pain by affecting the chemicals that the nerves use to talk to each other in the transmission of pain. One thing to keep in mind about these medications is they're often prescribed for pain relief alone. It doesn't necessarily mean that a person is diagnosed with a mood disorder and that's why they're being given this medication. At the same time, though, because pain often results in mood disorder as well, these medications can be used almost as an additive effect to also help with that as well. There are many different types of these medications, and again, education by a pharmacist, helping a patient understand how to properly take these medications, what to watch for with these medications are all a role that a pharmacist would take in ensuring the proper use of these. We use anticonvulsants. If you think about it, anticonvulsants are really used to sort of tame nerves that are overactive or misfiring. It was found a long time ago that these were helpful in pain. Examples of these include valproic acid and carbamazepine as sort of oldies but goodies. But more recently, we have medications like gabapentin and pregabalin that, although were developed as anticonvulsants, we use them far more for managing neuropathic pain. They're particularly good for that stinging, burning neuropathic pain. You'll often see patients with diabetic neuropathy, for example, being prescribed these medications. Can be very effective, also can have a number of different side effects. Getting patients started on these medications can be difficult as well. It often requires quite a lot of education about a gradually tapering on dose in order to minimize side effects and in order to make them more manageable for people. We also use muscle relaxants, particularly if we have pain that seems to be influenced by muscle spasm and the related pain that causes. There are special precautions about taking these medications. Some should be taken with food, for example, like cyclosporin, or not cyclosporin, sorry, like cyclobenzaprine, to avoid stomach upset and nausea. But one fairly common thing with all of the muscle relaxants is they mostly tend to cause some significant drowsiness, especially at first. and they also slow down your motor coordination. So they're especially to be used with caution for an individual who's driving or operating machinery. Two other that we'll talk about: cannabis. So cannabis, there's two components of cannabis: THC, which is tetrahydrocannabinol, and CBD, which is cannabidiol. And there's actually a system in the body called the endocannabinoid system. So just like anti-inflammatories react with the inflammatory system, cannabis interacts with the endocannabinoid system. And that plays a role in regulating a whole bunch of various physiological functions, including pain perception and possibly inflammation. So some individuals will report some significant relief from chronic pain, but it's not all the time. Effects of cannabis can vary widely among individuals, and in my own practice, I've seen it work very well and also not at all. There's a number of factors like tolerance, sensitivity, an individual's metabolism, the other medications that they're taking. Those can really all influence how someone responds to medication. And it's one of the reasons why pharmacists increasingly have become very involved in the use of cannabis as a medical product in order to evaluate a patient's therapy to see if the use of cannabis could be perhaps an improvement or perhaps a hindrance to the patient's overall pain management. There are different strains of cannabis and products with different varying proportions of THC and CBD rather, and these can produce different effects. And so it's always really important to understand the specific composition of the cannabis products that a person is using. There are side effects associated with cannabis as well, and some people like to downplay this, but you can get drowsiness, dizziness, impaired cognitive function. For some individuals, regular use of cannabis can lead to dependency. And cannabis can interact with other medications, and other medications can interact with cannabis as well. We want to make sure that any individual using cannabis has an open dialogue with their pharmacist and physician and other practitioners so that we can avoid potential drug interactions and so that we can monitor the therapy for the individual. Cannabis can also affect mood as well, and individuals with a history of mental health issues should be cautioned about the use of it and definitely should be monitored by a healthcare practitioner. Some people get, as I mentioned before, some people get a lot of relief from it while others find it not as beneficial. And so it's really crucial for individuals considering the use of cannabis for chronic pain to engage in open communication with a healthcare provider. So I would strongly encourage anybody listening to this. The Health Depot is a great place to get information about this. You can contact us and speak to one of our pharmacists, and we can give you some guided information about cannabis use and how that may impact your other pain management. And then finally, we have opioids, the big elephant in the room all the time. These days especially, the examples of this include oxycodone, hydrocodone, and morphine. There are many other examples as well, and newer ones coming online. The newest guidelines recommend trialing and optimizing any of the therapies we've already talked about before ever considering starting opioids for chronic pain. We really, really commonly recommend, obviously, that anybody considering the use of an opioid only do so under the guidance of a healthcare professional and with frequent follow-up and monitoring. There are a lot of potential side effects associated with opioids. They can be minor and self-limiting or manageable, things like constipation, for example, or they can be much more severe, like the risk of dependence or addiction or overdose. And anybody that's been prescribed an opioid, even for just short-term use, for any kind of pain management, should have a naloxone emergency kit in case of accidental overdose. Overdoses can occur even when you're taking your opioids as prescribed. So it's very important that you have this life-saving medication on hand should you ever need to use it. Naloxone kits are available free of charge through pharmacies, and our pharmacists will spend the time to go over that kit with you and explain to you exactly how to use it. So just generally some important considerations when it comes to medication use. First and foremost is consultation with your healthcare professionals. It is very important that any individual who's using medication to treat pain have open and honest dialogue, and they consider them part of their team before starting or changing any medication regimen. It's important that they really understand what the medication is designed to do, how it's intended to help with pain, how it's properly taken, how to monitor for its beneficial effects, but then also look at what do I do in terms of side effects? How do I watch for those? What can I expect? Is there anything I can do to take care of that? And all of this treatment should be very much individualized for the individual, and also should incorporate those non-medication strategies that we talked about before as well. So your pharmacist in chronic pain management, pharmacists are a valuable member of your team when you're facing treatment for chronic pain. And the pharmacists at the Health Depot Pharmacy are changing the face of pharmacy by helping to personalize medications and bring a new level of collaboration into the community setting. Our accessible and convenient online presence affords us the opportunity to focus on your well-being. And we do that through a number of different services we offer. So medication review and management. Pharmacists can review an individual medications, and that helps to ensure that they're appropriate, effective, and safe, and that there are no potential drug interactions. We can also work with other healthcare practitioners on the team to optimize medication regimens, adjust dosages, or recommend alternative medications to achieve better pain control. Plus, we aid in the setting of what are known as SMART goals for pain management. So SMART means specific, measurable, achievable, relevant, and time-bound. And we can help you determine how to make different goals, track and monitor those goals, and communicate that back to your healthcare team. In addition, we offer programs to synchronize medication refills, helping to simplify the management of multi-medications, and also offer programs to help you stay on top of taking your medications regularly. We provide conveniently education on medications by phone or by video call, so we can provide clear and understandable information about the medications you've been prescribed, including their purpose, potential side effects, and how to take them. And we can also help you understand the risks. So we can educate you on risks associated with certain medications, especially opioids, and help you manage expectations regarding pain relief and potential side effects. We offer over-the-counter recommendations, and at the Health Depot, we also have an online store, so we can conveniently not only recommend OTC products that sort of add additional pain relief for you, but also can get those delivered right to your door. We can recommend suitable products like topical creams, for example, or other analgesics, and we can make sure that they complement your prescribed medications and don't interact in a bad way. We offer monitoring and adherence support. So again, tools and guidance on how to measure and monitor your pain, and then communicate that to your healthcare team. And we assist in that monitoring for potential side effects for medications and help to guide individuals on when to seek medical attention. We're also collaborative in terms of our care with your other healthcare providers. Pharmacists are great communicators. We collaborate with physicians and the rest of the healthcare team involved in your care, and that helps to contribute to a cohesive care plan for each individual that has chronic pain. And we also actively involve the individual in shared decision making, ensuring that individuals are informed and empowered to manage their pain. We offer opioid stewardship principles. Given the concerns surrounding opioid use, pharmacists play a key role in ensuring the safe and appropriate use of opioids, including counseling on proper administration, storage, disposal, and potential risks. And again, we offer naloxone kit supplies as well as training. And we're accessible and convenient. So our pharmacists are easily accessible, providing a convenient point of contact for individuals to discuss their pain management concerns with a healthcare professional. So by involving a pharmacist in chronic pain management, individuals can benefit from personalized guidance, medication optimization, ongoing support, and all of those things contribute to a more effective and holistic approach to pain care. And it's essential for individuals to establish open communication with their pharmacists to maximize the benefits of these services. So a few key takeaways from what I've talked about today. First of all, remember pain is very complex and requires an individual approach. Chronic pain management is very much nuanced. A personalized multidisciplinary approach offers the most effective solutions. Movement, mind, and medication, the 3 M's, offer improved pain control beyond the sum of the individual parts of that plan. Pharmacist involvement ensures safe and effective medication use and contributes to comprehensive and personalized chronic pain management. And we at the Health Depot offer very convenient professional services that can help you gain control over chronic pain. This concludes my presentation. I'm really be happy to take a few questions from our audience before the end of the presentation today. So if anybody has any questions, I would encourage you to perhaps raise your hand and I can, or just unmute and go ahead and ask, or you can also ask in the chat as well. All right. Seeing no questions, thank you very much for everybody's time today. I really appreciate it. I will hang around till the end of the call in case there is any additional questions. And I look forward and hopefully being able to speak to you again in the future. Thanks, everyone. You're welcome. All right. I will leave the presentation. Thank you very much. Bye now.